My name is Jazzie. I'm a PNW nursing student. I'm just going to sanitize my hands here and wash them prior to coming into the room. And, with COVID and everything else, just want to make sure we're safe. Do you mind if I take a look at your ID band here? Perfect. Can you just tell me your name, age, and date of birth?
March 31st, 1998, and I'm 22.
Perfect. And I don't see an allergy band on you. Do you have any allergies?
Yes, I'm allergic to azithromycin and to some kinds of adhesives.
Okay, and what happens when you take azithromycin?
My face swells up.
Oh, that is a serious allergy. Okay, and then what happens when you have certain adhesive bandages?
I get a rash.
Okay.
So some of them are just sensitive, so.
Okay.
Yep.
No, do you mind if I just do a quick general survey on you?
Absolutely.
Okay. So I have a 22-year-old Caucasian female who appears stated age and has an obese body type and appears well-nourished. Her facial features are symmetric. Her speech pattern is normal with appropriate use of vocabulary. The patient's posture is erect. Her gait appears to be smooth, steady, and well-coordinated. The patient appears to be well-kempt without any soiled, worn, or torn clothing. Her general cleanliness appears to be clean in regards to her hair, nails, and skin. The patient is cooperative and attentive and answers all questions appropriately and follows all commands. And I believe that's everything. Oh, she has no signs of distress. Her facial features are symmetric. And I believe that's everything. Okay, so we're going to move on to your neurological exam now. So can you just repeat your date of birth for me?
March 31st, 1998.
Okay, and where are we today?
Pretty Northwest Hospital.
Okay, and can you tell me the month and the year?
Year 2020.
Okay, and what were you looking to have done today?
Just a general assessment.
Okay, patient is alert and oriented times 4. I'm going to assess your memory now. So can you tell me what you had for breakfast?
Cereal.
Cereal, great breakfast. And where were you born?
Hammond, Indiana.
Okay, and I'm going to give you 3 words. If you could just repeat them to me, I'm going to ask you them a little later. Okay, it is cat, ball, truck.
Okay.
Okay, so I'm going to assess your judgment. So what would you do if you found a lost child?
I would call 911 and stay with the child until they came.
Perfect. Her judgment is appropriate and intact. How do you interpret the phrase, it's raining cats and dogs?
It's raining heavily outside.
Okay, and her abstract thinking is intact. And do you know who the U.S. president is?
It's Trump.
Okay, general knowledge is intact. And then can you repeat, I'm sorry, can you count backwards from 10 to 0 by 2s?
Absolutely. 10, 8, 6, 4, 2, 0.
Perfect. Patient can compute simple serial calculations. Do you remember those 3 words I gave you?
Ball, cat, truck.
The patient's recent, remote, and recall memory is intact. Next, I'm going to just ask that you close your eyes and outstretch your hand. I'm going to place an object into your hand. If you could just tell me what it is.
Okay. That's a pen.
Perfect. The patient's stereognosis is intact. Next, if you could just remain your eyes closed, if you could just keep your hands outstretched, palms up, I'm going to write a number in each of your palms. If you just tell me what it is.
2.
Okay.
7.
Yes. The patient's aphasia is intact. Okay. Next, I'm going to have you remain with your eyes closed. I'm just going to hands, palms down. I'm going to do a sharp and dull test. So I'm just going to ask, it's not very sharp at all. I'm just going to ask that you tell me when I touch your hands if it's sharp or dull sensation. Okay?
Sharp. Sharp. Dull. Sharp. 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 I don't know what that one was. Dull. Sharp. Dull.
Okay, perfect. And next I'm going to take this tuning fork here and I'm going to just put it on the tops of your wrist. You can tell me if you feel any vibrations, okay? Perfect. The patient's vibratory sense is intact. Next, I'm going to ask that you keep your eyes closed, hands outstretched, palms down. I'm going to move your fingers up and down. I'm also going to repeat this on your toes afterward. We're going to do your fingers first. You can just tell me if you feel them up or down, okay? positions of your feet down?
Up, down, up, down.
Perfect. The patient's proprioception is intact. Next, I'm going to just assess your cerebellar function. These are commonly known as like the drunk test.
Okay.
So if you can just take your fingers and touch them to your thumbs. Perfect. Next, I'm going to ask that you take your hands and you move them up and down as fast as you can on your thighs. Perfect. I'm going to ask that you stand up, and you can just take your heel and run it down from your knee to your down your shin.
Okay.
On both sides. Perfect. And now while standing, if you can just close your eyes, hands outstretched with your pointer fingers, and just touch the tips of your nose for me. Perfect. And her cerebral function is intact. While we're standing, I'm going to ask that you just walk normally to this side of the room for me. Perfect. And if you can walk back heel to toe.
Oh, hello.
Okay. And then if you could just face the wall, I'm going to stand right here. I ask that you put your hands outstretched in front of you. Feet shoulder width apart. If you just close your eyes. Perfect. That was a Romberg's test. Just test if you sway. And it was negative for you. So good job. Patient's cerebellar function is intact, and her gait is steady, well coordinated. Next, I'm going to assess your reflexes. So, yes, I do. So I'm going to do it on your elbows, your knees, and then I'm going to run it on the bottom of your feet to do a Babinski test. Okay? So first I'll do your elbows. We'll start from top to bottom here. Okay? Okay. Perfect. Okay, now just do your feet. Perfect. Okay, awesome. You have a negative Babinski test, which is perfect.
Okay.
Okay. And that concludes our neurological exam. Next, I'm going to do our cranial nerve assessment. So I'll try to go in as order as possible. Okay. So our first one is the olfactory nerve. So this is just going to test your smell. So I'm going to ask you to close your eyes. I'm going to put an object underneath your nose. You can just tell me what it smells like.
Cherries.
Perfect. Okay, next, her cranial nerve 1 is intact. Next, I'm going to assess your second cranial nerve, which is your optic nerve. And so basically, I'm going to test your visual acuity. So I'm just going to stand here with the Snellen test. I've actually seen this at every doctor's eye appointment that you've had.
Yes.
You can just read the smallest line that you can see.
F-E-L-O-P-Z-D.
Okay, perfect. You can't read anything below that?
No, I'm kind of blind. It's blurry.
Okay. Patient has a visual acuity of 20 out of 30. Next, I'm going to
Eye doctor again.
I'm going to kind of assess cranial nerves 2, 3, and 6. I'm sorry, 3, 4, and 6, which is the ocular motor nerve, the trochlear nerve, and the abducens nerve. It's basically just eye movement test. I'm going to use my curl light here. So basically, we're just going to perfect. Just going to assess your pupil dilation here. Perfect. Patient is pearl. And then usually for the oh, I'm so sorry. That is not the cranial nerve that I'm doing. For the third cranial nerve, we do a lid lag test. And I've been watching you blink, and it's completely normal. You have no lag there. So next, we're going to move on to the fifth cranial nerve, which is the trigeminal. And so basically, for this one, we would do a corneal reflex test, which is basically I would have you look up. I would blow into both of your eyes, and if you blinked, that is a positive test. It's a good thing. You have that reflex. However, we're not going to do that today because of COVID. However, I am going to do facial sensation on you. So it's the same sharp and dull that we did on your hands, but on your face. As well as I'm going to ask that can you just pretend like you're chewing gum for me? Perfect. All right, and then let's just do this facial sensation.
She's doing that again. I was not ready. Sure.
Perfect. All right, cranial nerve 5 is intact. Next, we're going to do your 7th cranial nerve. This is the facial nerve. And so for this one, we would do a taste test on the front part, 2/3 of your tongue. We would soak like a cotton swab and something sweet, something salty. This would help us to visualize tear and saliva production. However, we're not going to do that today, again, because of COVID. However, I am going to ask if can you smile for me? Okay, and then can you puff out your cheeks like a blowfish? Okay, can you raise your eyebrows for me? Perfect. That also assesses our 7th cranial nerve. So that nerve is intact for you.
Okay.
Next, we're going to move on to cranial nerve 8. So cranial nerve 8 is it's our acoustic nerve. And so we have 2 tests. One is the Webner test, which is I would take the tuning fork, I would strike it, I would put it in the middle of your head, and with that, you would be able to tell me if you hear it out of both ears, and if you did, that's a great sign. That's you passed the test. The next is the Ryan test, in which I would strike the tuning fork, I would put it by your ear, and once you didn't hear any noise anymore, I'd move it to the mastoid process, which is connected to the base of your skull, and you should be able to hear the sound again. Again, we're not going to be doing that one today. However, I will be doing a whisper test on you, considering we've already done a balance test when I assessed your gait in the neurological assessment. So I'm just going to stand over here, and I'm going to whisper a sentence to you. If you can just repeat that sentence, okay? The dog is brown. The dog is brown.
The dog's brown.
Yes. Perfect. Next, we're going to move on to your 9th cranial nerve, which is the glossopharyngeal nerve, which is, I'm going to assess your ability to swallow, so can you swallow for me? Perfect. And with this one, we would assess the back portion of your tongue using those same lid weights we used in cranial nerve 7. However, we're not going to be doing that today. And I would also assess your gag reflex. I would take a tongue compressor and I would put it in the back of your tongue to initiate a gag reflex, or I'd give you something that didn't taste the best to kind of just insinuate that gag reflex. But we're not going to do that today to you, so lucky you. Moving right along, we're going to assess cranial nerve 10, which is your vagus nerve. And basically, that is assessing your speech, which you've been talking to me quite normally, clear speech, great use of vocabulary. We would also assess the the rise and fall of your uvula. So if you can just remove your mask, I'm gonna keep my on and open your mouth, stick out your tongue, and say ah for me. Perfect. And then also we would do a vagal response on you, which is just determine like fainting. We would do an EKG, an echocardiogram, or a stress test, just to basically make sure there's no cardiac issues, you have no cardiac valve malfunction or whatever. But we will schedule that for a later time. Get you probably an EKG because it's the easiest, it's fastest, and it gives us a lot of information in a very short amount of time. So you have passed cranial nerve 10. Moving right along to cranial nerve 11, which is the spinal nerve. And so basically, can you shake your head? Okay. Can you touch your ears to your shoulders? Perfect. Can you shrug your shoulders for me? Okay. Can you shrug them against? Can I touch your shoulders? Okay. Can you just shrug against resistance? Perfect. Cranial nerve 11 is intact. And finally, we come to our last cranial nerve 12, which is the hypoglossal nerve. And so basically this tests tongue location and movement. So if you can just remove your mask and stick your tongue out, straight out, and then move it side to side for me. Perfect. Your last cranial nerve is intact. If you have any more questions, feel free to ask me. I am your Nurse Jazzie. The doctor will be in to see you shortly. Okay, any questions?
No, I'm good, thank you.
Perfect. Thank you so much.